If you're fed up going to doctor after doctor and being told you're fine when you feel absolutely not fine, then this video is for you. We do live in a medical model of what we call sort of siloing symptoms and conditions. And so when you go to your doctor, they're trying to look at what silo or what box you fit in for a condition or a disease. And if you don't fit into a box, then they kind of don't know what to do with you because, you know, if I want to be kind to the doctors, I think all doctors become doctors because they want to help people. So I'm not arguing that point. But I wonder why they don't get to the point of being tired of just handing out drug, drug, drug and not asking why. Not standing back and looking at that bigger picture. But in their defense, so that was the attack, now the defense. The defense is that they are required, so to keep their job, they are required to have a diagnosis code to put you in a box, put you in a silo of a condition so that then they can prescribe a drug. And that is sort of the simplicity of our medical model, other than if you need surgery. So what's missing there is that when they do testing, they're looking for gross levels of things being too high, things being too low in your blood test. Certainly doing scans and looking for tumors, and you know, they're looking for sort of the big bad thing that could eventually get there, but because it's not at that point now, they don't know what to do with you. So also, it's important to realize that our blood tests have a very wide margin of what's considered normal and okay, and it is way too wide. So what needs to be done is that, and this is something we do with our patients, is show them here's this normal that supposedly is normal, and then here's optimal. It's a much more narrow range. It's a much more sensitive level, because as you well know, you can feel terrible yet be told you're fine. Your blood tests are fine. And the other problem with that is that just a blood test is not enough. You know, a blood test does not look at whether you have food reactions or food sensitivities. A blood test does not measure your microbiome, that's 60 to 100 trillion organisms in your gut, and say, do we have inflammation? A standard blood panel is not looking at sex hormones. It's not looking at toxicity like mold or heavy metal. It's not looking at any of those things. So when you're told you're fine and you don't feel fine, know that there's a reason, and it's not your fault. You need to then find somebody who's going to look. You know, one of the tenets of Root Cause Medical Clinic, my clinic, is that there's always a reason. The body always has a reason for giving you symptoms, and we have this sort of motto that, like, we're very tenacious, doggedly going after what is it, and a lot of times it's not just a single thing, it's a few things that sort of come together to create the situation, but you have to get that holistic view and look at the whole picture and say, okay, it's a little bit of this, and it's a little bit of that, and it's a little bit of that. And we talk about the body being burdened, and you identify and remove the burden, and you identify and remove, and you identify and remove, and then the body says thank you very much, and it comes up to health, and it regains its health. So I just want you to know it's something that really frustrates me and annoys me, and I know you're in this situation too if you've had this experience where as soon as, you know, first of all, you can go to the doctor and say, I don't feel well, and they're like, hey, great news, you're fine. And you're like, oh, well, that's good. You know, like, I don't have anything horrible. That's, you know, that makes you feel better. But then, you know, then you leave and you're like, yeah, but what about all those symptoms I have? What are those about? And if you pursue going to your doctor again and again, it won't be long before your doctor will intimate it's all in your head. Are you under stress? Is it busy at work? How's your home life? And I'm not saying those are not good questions to ask. They are good questions, but not when it's coming from they're just trying to find a reason to give you an antidepressant or an anti-anxiety medication. So I'm doing this particular video just to support you in knowing what you know is true, which is it's not in your head, you're not making it up, there really is a reason, and there are ways to find what those reasons are, and we're here to help. So if you like this information, if you like the channel, please subscribe, give us a thumbs up, and you know, in the description you can see how to contact us for a consultation. We are here to help. That is what we do. That's all we do. And I want you to know that there are answers for why you feel the way you do. I'll talk to you soon.